Welcome. We're here today to talk to you about a keto way of eating for lipedema. And the first thing I want to say is happy holidays. We wish we were in Rome with you, but we're happy we can join this way. So our financial disclosures, we have no additional financial disclosures. So I'm going to just start right in with what is the fat disorder lipedema? Well, I'm sure you've had quite a number of talks already today, but it's little known, generally misdiagnosed. It is a fat disorder. It's primarily in women. It results in localized painful fat in the lower body. This is stage 1, 2, 3, and 4. Generally, it's mostly the thighs, hips, buttocks, some cases the upper arms. The thing about lipedema is left untreated and unmanaged, it progresses and worsens over time, and ultimately can lead to lymphedema, or a condition called lipolymphedema, which is lipedema and lymphedema, and immobility. And the thing about it is it shows up very differently in different women. So what can look like one particular stage in one woman can look like another stage in another woman, and it's also affected by different comorbidities. So as you can see, all of these women have different forms of lipedema. Some of them have lymphedema as well, but it's very complex because of just that fact that it's unique in everyone. So one of the issues that most women with lipedema face is the fact that there's very little known about it. And going to doctors can be very complex. These are some of the stories that we hear, is that my doctor doesn't believe me, he won't listen, he says it's a crazy made-up internet disease. A lot of doctors will say it's your fault, you should just lose weight and exercise. And ultimately, what the story is that we hear again and again in different versions is that most doctors just don't believe that lipedema exists. So that leaves lipedema ladies feeling powerless, having to deal with lipedema day in and day out, and no matter what, no matter how hard we all try, nothing seems to make a difference. And one of the things that I do want to reassure you is that our lipedema ladies do try very hard. One of the things that we found that was very helpful is a holistic approach, that lipedema is complex. So there's a physical, emotional, mental, psychological, spiritual, and social aspects. And it affects us on all these different levels. So we developed a master class, which we call Beyond Lipedema, where we've worked with various groups of women in order to help develop, customize, and refine a protocol for mastering their life with lipedema. And so our participants, we've had 5 classes to date. The age range is 30 to 70 years old. There are 10 to 20 participants per class. We've had 70. We just started another class with 25, so we're close to just under 100 that we've worked with in the past really year and a half. They're all in various stages of lipedema and lipolymphedema, and many of our participants have struggled to get a diagnosis. Again, as many of you may be familiar with, this is actually from the book that we wrote, the overview for clinicians. Their lipedema fat is resistant to diet and exercise, or so it's been believed. I'm happy to say in 2015, I met Leslyn Keith, whose research was looking at a ketogenic way of eating for lymphatic disorders. And while her original research was on lymphedema, we looked at each other at NIH when we were in Bethesda, and we said, do you think it would work with lipedema? And the next year we began a process where we started to try it and to see what happened. This is Leslie's original research with her lymphedema and obesity patients. Simple, real food, low carb, high fat, moderate protein. But this is Emma. She lost 350 pounds in 2.5 years on keto alone. And this is a woman who, when we started, she was one of our first ladies, and she lost 40 pounds, and you can see significant changes. And in these before and after, this was a 4-month period. You can see a change in size, but what's even more significant is you can see a change in inflammation. And one of the things I think that's important to note is that age does not seem to make a difference because many of our patients are older. And I'm going to end on this slide. Though the scales showed no weight loss, in 3 weeks you can see a visible change in the reduction of swelling and bloat with this patient. So I'm going to turn this over to my colleague Megan, who's going to talk a bit about the science of keto.
Thanks, Catherine. Hi, I'm Megan Pfeffer. I'm a clinical nutritionist and I have a health science degree in nutritional and dietetic medicine, and I'm going to be talking about ketogenic diets for lipolymphedema. As most of you would know, lipedema, obesity, and secondary lymphedema are collectively known as lipolymphedema. The risk of lipedema progressing to secondary lymphedema increases with age and is associated with over 50% of lipedema patients, and commonly caused by morbid obesity, which is defined as a BMI greater than 40. Typically, our masterclass participants have lipolymphedema and are morbidly obese. They're usually pre-diabetic with various hormone dysregulations and have various other comorbidities. Lipedema begins with disproportionate gynoid fat distribution, however can progress to android gynoid obesity. And this combination is associated with higher inflammation and cardiometabolic risk factors, systemically and within the adipose tissue itself, a risk that's higher than either android or gynoid adiposities alone. And this is linked to insulin resistance in adipose tissue. We now know we can therapeutically intervene to lower inflammation, reduce BMI and other metabolic markers by changing the diet. But the key is changing the diet to one where people can really enjoy the food and feel satisfied for long-term adherence, and where bio-individuality is recognised. Obesity is an inflammatory disease and the main risk factor for causing insulin resistance, particularly when gynoid adiposity progresses to abdominal and visceral adiposity. Insulin resistance is also referred to as carbohydrate intolerance, where cells no longer have an appropriate response to the hormone insulin and it becomes increasingly difficult to utilise glucose in the bloodstream for energy. After many years, usually decades of insulin resistance, prediabetes can develop as insulin is no longer able to keep blood glucose levels in check. So why would we prescribe many carbohydrates to people who can no longer tolerate them? When high calorie restriction for weight loss doesn't provide satiety or the ability to feel full and satisfied, it eventually slows metabolism, even more so if severe calorie restriction is combined with intensive exercise, as shown in a study by Finney et al. The body then upregulates hunger in an attempt to restore calorie intake to meet the demands of the body. And if the restricted calorie intake diet didn't address sugar cravings or carbohydrate intolerance and addiction, then the increased hunger will likely drive a high carbohydrate intake, whether that's sweet carbohydrates in the forms of sugars like lollies and chocolate, or savoury carbohydrates such as breads and pasta. Rapid weight gain ensues, often ending with rebound weight gain. So at the Lipedema Project, we like to help people to refocus. Those with lipedema and lipolymphedema are constantly told they simply need to eat less and move more, which is basically saying they're gluttonous and they're lazy, which we refer to as blaming and shaming. It's their fault. But it's not their fault. They have a disease with genetic underpinnings that can be exacerbated with inappropriate carbohydrate intake for their body type, driving processes such as adipose hypertrophy, hyperplasia, inflammation, which then initiates any number of chronic disease patterns. So what is a ketogenic diet? It's any diet which reduces the carbohydrate content to typically below 50 grams. That can differ for depending, athletes, for example, will use more, but typically we find with this group of women below 50 grams, sometimes that can be even lower, of carbohydrates, which is an amount that puts you into nutritional ketosis. And this is going to be an individual thing based on metabolic health. Reducing carbohydrates forces the body to seek an alternative fuel source, which is fat. In other words, it switches the body from burning glucose as its predominant fuel source to burning fat in the form of ketones. And it focuses on healthy fats and moderate protein to balance blood sugars and provide satiety, whilst balancing electrolyte and micronutrient intake. There are some contraindicated conditions with ketogenic diets, so ensure you talk to a suitably qualified health professional prior to starting or recommending a ketogenic diet. So what does keto food look like? It's just real whole food. This just gives you an example of 20 grams of carbs in two ways, one with a very small piece of bread and the other with a really abundant, beautiful bowl of fresh, complex carbohydrates in the form of vegetables. So you're not eliminating carbohydrates, you're really changing the focus of them. So diets designed to target the reduction of inflammation have been highly recommended by leading lipedema clinicians and researchers, and that clinical care should primarily be aimed at reducing visceral and abdominal obesity and its associated insulin resistance, in addition to fighting chronic inflammation. Weight loss and blood sugar control have been shown in long-term studies to reduce bioinflammatory markers such as C-reactive protein. Ketogenic diets are appetite suppressing, which is a large part of their success in this demographic. Relearning hunger and satiety signals becomes possible in the absence of blood sugar cravings and binge eating. And a couple of research, the impact on lipid profiles is frequently a concern amongst health professionals. Another common concern is that a ketogenic diet is unsustainable. In this 6-month randomized controlled trial comparing a ketogenic diet to low-fat, low-cholesterol diets, showed a higher proportion of the low carbohydrate diet completed the diet with increased weight loss, lower triglyceride levels, and higher HDL levels. In this 2-year study, participants showed clinically significant improvements in their glucose control, with more than half showing reversal of type 2 diabetes, metabolic syndrome rate, and markers of inflammation. And my last slide, low carbohydrates are also shown to improve lifestyle factors such as sleep quality. And this study, published in Sleep Medicine in 2019, showed improved sleep quality and less sleep disturbance. So I'll be available in the Q&A session afterwards, and thank you.
So I'm really delighted to have Carol Roseschmidt with us. She is our colleague, and her expertise is in thyroid functioning and understanding something called the famine response, which I'll share with you. It's been exceptionally useful with our lipedema population.
Thank you. My goal today is to present you with a different way to evaluate and treat thyroid, and this is particularly important in those who are trying to lose their excess weight. A simplified view of thyroid control is that the anterior pituitary produces thyroid stimulating hormone, which stimulates the thyroid to make both T4, the main circulating hormone, also known as levothyroxine, and T3, liothyronine. T3 is the active hormone. T4 in the circulation is taken up by the liver and other organs and converted to T3. So the current dogma is measure TSH and treat with T4. That assumes conversion from T4 to T3, and it also assumes a stable set point. So under normal functioning, yes, we do have a stable set point for things like temperature and metabolism, and that's part of our system of homeostasis, which is normal maintenance of a normal condition, and that's a part of the bedrock of our understanding of human physiology. But in the famine response, when you get insufficient food intake to maintain body weight, the brain interprets it as famine. You don't have to be on an extreme diet for this to happen, and it can occur regardless of fat stores. There's a lowering of the set point for metabolism demonstrated in 1979, and the metabolism does decrease via changes of thyroid hormones to save your life during the famine. Many, many studies over the years have shown this. It may occur less commonly in ketogenic eating, but as Catherine points out, we are seeing this in a number of our patients, and in my private practice, I've seen a lot of it over the years. Your typical patient, middle-aged woman, lipedema or general obesity, some dieting, history of dieting, loses some weight and then hits a plateau, notices symptoms, coldness, fatigue, hair loss, and they go into their primary care provider, and that person measures thyroid stimulating hormone. That's what we were all taught to do. It's normal, it's perfectly normal. They're told, watch your diet, exercise more, you must be eating more than you think. But let's look at the next slide to show what's actually going on here. You'll see that the serum T4, remember that one is not the active hormone, but that's what we usually treat with. That stays the same, it does not dip during the famine. But the serum T3, the active hormone, does dip dramatically, and it stays down during the length of that famine. And then it starts going up again after the famine's over. What's TSH doing at the same time? You can see that it's dipping and going back up again, and it's going back up before the famine's over. A small sample size, I know this doesn't show it as well as we'd like to see it, but it does go back up before the famine is over. But it's within normal limits the whole time. So it's not showing anything that would be noticeable just by a spot check. So here's my hypothetical sketch of this. The gray area shows you the normal ranges for both of the hormones. If you look at TSH, before the famine, it's about mid-range. It dips down a little bit, comes back up before the famine's over. And the free T3 drops. There's a difference in units between what I've shown you before here, but this is free T3. The other was total T3, slightly different measure. It doesn't really matter for our purposes. So patients are often at the very low end of normal and displaying any of these symptoms, maybe other symptoms, cold, tired, constipated, depression, hair loss, dry skin, as well as an inability to lose weight when doing all the things that had worked before, and that person is stuck. So you can see the set point for T3 has been lowered, and the symptoms match the T3. They do not match the TSH. They do not match the T4 if we had the T4 on here. So these people are as close to hibernation as a human gets. If we were following T3 and symptoms, we'd be seeing it and we'd be treating these people to resolve their symptoms and to allow weight loss. But that's typically not being done. So in conclusion, this is adaptive when food is scarce, but it makes it hard for our people who are trying to lose excess weight. So I'm advising measuring the active hormone T3, understanding that the set point changes. This is a simplified version. Reverse T3 comes into this too for some people. Don't have time to discuss it today, but you can ask me questions afterwards or email me. Thank you very much.
Thank you so much for having me and my colleagues here to present about how a ketogenic diet can help with lymphatic and fat disorders. We are excited to share with you what we've learned. My colleague and I, Mindy Staggs, will be talking to you about what some of the mechanisms about why this works, and Mindy will share with you her story of what's happened with her and her journey. A couple of disclosures: I do have a book about ketogenic solution for lymphatic disorders, and I also have a weight management program for people with lymphatic disorders, and Mindy is a keto coach for Lipedema Simplified. So a ketogenic way of eating, what is it? It's just real food. You can see from pictured here that it's just real whole foods, nothing packaged and processed. It requires carbohydrate restriction. So carbohydrate intake is very low on a ketogenic way of eating. And we concentrate on eating healthy fats and getting an adequate amount of protein. So it's not high protein, it's not low protein, but we do need to have the correct amount of protein in our diet. I started on this journey when I did a lifestyle modification group, a research project with people who had lymphedema and were obese. and it encouraged the adoption of a ketogenic diet. And we found in that group that there was greater volume reduction in the lymphedema and greater weight loss, as well as 8 other outcome measures were all significantly improved with the people who adopted a ketogenic diet. So then we wanted to know, could keto work for someone with lipedema? Because we know that there is a disproportionate deposition of fat to the lower half of the body, they often complained of hypersensitivity and pain and easy bruising. And of course, it's widely believed that lipedema is resistant to diet and exercise. So would a ketogenic diet work for this? And anecdotally, what we're seeing that it certainly does work. And here is Kim, who lost 181 pounds in less than 2 years. And her quote is, "No surgery, no exercise, just food." And so what we found anecdotally in our groups with women with lipedema is that they had fat loss on the lower half of the body, not just the upper half. They had decreased or completely resolved pain. They had increased energy, better mental clarity. There was an absence of hunger and a feeling of satiation. And of course, the edema resolved or reduced. So why does it work? What are the mechanisms? And so what we found is that carbohydrates are inflammatory. This is a study with rats conducted in 2012. And what they found that rats fed a high fructose diet had a 50% reduction in transport capacity in the lymphatic system because of the inflammation. And also it is known that carbohydrates are inflammatory because it destroys the glycocalyx, that lining of blood vessels. When we have hyperglycemia, even for a short term, it increases the permeability and we have increased lymphatic load due to the swelling and the increased fluid volume in the tissues. We also are discovering that the lymphatic system runs better when it is given adequate amounts of healthy fats. This is another animal study showing that fatty acid beta oxidation is intimately involved with lymphangiogenesis. So when they were animals were fed or administered a agent that inhibits fatty acid oxidation, we have reduced lymphangiogenesis, but given acetoacetate, a ketone, they had increased lymph vessel growth. Several studies have also shown that obesity and not a high-fat diet impairs lymphatic function and can worsen lymphedema, but a high-fat diet does not cause this to happen. And we know from studies from Natasha Harvey and others in Australia that acute inflammation like a infection causes lipolysis because the lymphatic system, the immune system is using fat to power itself. And during chronic inflammation, like lymphedema, there is increased lipogenesis. And you can see from the cross-section of a lymphodematous arm versus a normal arm, we have increased fat deposition. And also we know that ketogenic diet reduces pain, and several studies have talked about the mechanisms for this. One is talked about the altered metabolism through ketosis, and that reduces pain. It also commented that a ketogenic diet has been long used as an anticonvulsant, and the same medications that are used to decrease seizures are also used to decrease pain. And also a ketogenic diet mimics fasting, and we have seen that fasting reduces pain as well. There was a great study that was conducted, was completed in 2019 in Norway, and it was looking at the effect of a ketogenic diet on pain, body composition, and quality of life for women with lipedema. We have not seen the results of this study yet. We're looking forward to see what they're finding is happening for a ketogenic diet for women with lipedema. So now I'd like to turn it over to my colleague, Mindy Staggs, who will be talking to you about her story.
Thank you, Leslyn. Hi, my name is Mindy Staggs. I am 46 years old, and I have been overweight, or actually I've been obese all of my adult life. And I have struggled with my weight since my early teens, and I also have lipedema. I have hereditary lymphedema, and my highest non-pregnant weight was 265 pounds. It's hard to find a full-sized picture or full-length picture of me before, because I would always hide behind kids or my husband in photographs. So both of these before photographs are of me from the rear, which does show that I have the classic lipedema shape of the small waist and the large hips and thighs. I also had migraine headaches, more than 20 migraine days a month. And those started when I was about 6 years old. They didn't progress to being that frequent until I was in my teens. I had unmanaged polycystic ovarian syndrome that was medicated but not managed. I had high cholesterol, and my blood pressure was would run on the high end of normal or sometimes was elevated. And so I struggled with this. So how did I feel as a woman who was obese and who had lipedema? Well, I was often told by the doctors, just eat less and, exercise more, eat plenty of fresh fruits and vegetables. If you would just lose weight, you would feel better. If you would just lose weight, you would stop having headaches, or your headaches would get better. And I felt like I was powerless to make any change. I didn't feel like the medical community offered me any real solutions. And of course I had tried to lose weight. Of course I had dieted multiple times throughout my life. And every time I would lose some weight, the diet would stop working and I'd start gaining it back. And I had yo-yo dieting pretty much since my early teens. I felt very hopeless. I felt like there was no hope for me but to be the size that I was. In fact, I had given up and decided that I was just supposed to be 250 pounds. And that was just the size my body was supposed to be. Now, when I got my lipedema diagnosis, I had mixed emotions, because I was like, aha, finally, it's not my fault. It's not my fault that I'm this way. But at the same time, I was being told that diet and exercise would never change it, and that it was a progressive disease and there was no hope for that. So it was, and of course I couldn't afford liposuction. So, that was a very sad aspect of that as well. So when I heard about the ketogenic way of eating for lipedema, I was very skeptical, but I was also very determined. And I began the keto diet in September of 2016 with the same determination that I began every other diet in my life, but yet I was afraid that I was going to fail. And I didn't. Everything started happening in a hurry. As you can see there, I have a very stable weight from several years around that 250 mark, and then I began the ketogenic diet and the weight just began to drop off. My starting weight I actually don't know, because I hated to weigh, I hated to be on the scale, but I'm guessing I was somewhere around the 250, 260 range. I was a size 22 US in pants, and I've lost about 100 pounds. My waist measurement has gone from 38 inches to 20, or from 35 inches to 25 inches, so a 10-inch decrease. My hips have gone from 53 inches to 38 inches. That's a 15-inch decrease. And I've gone from a size 22 in clothes to a size 6, which I've never been in my life. My migraine headaches have completely resolved. I've been migraine free since I started that ketogenic diet in September 2016. My swelling and my pain are well controlled. I can wear my wedding rings again that I couldn't wear for 25 years. I actually wear a smaller shoe size. My PCOS symptoms are now well managed. I never had great management of them before. And my blood pressure runs on the low end of normal now instead of the high end of normal. People often ask, well, what about your cholesterol? Isn't eating all of that fat going to make your cholesterol go up? Well, it didn't for me. Now, this first set of numbers was actually after I had already started the ketogenic way of eating. So they were even higher before that, but I don't have those numbers. But these are my newest lipid profile numbers. And as you can see, it's greatly improved, including that triglyceride HDL ratio. I'm well within a good range there. So this was me before, and this is me now. And a lot of people who have known me my whole life but haven't seen me in the last 5 years don't even recognize me. I'll walk up to people in the grocery store and say, hi, how are you doing? And they'll look at me like I have no idea who you are. And it's because this is not the person I am today doesn't look anything like the person that I was before. So if you are a medical provider who's treating ladies with lipedema or anyone with lymphedema, if you would just please research this way of eating. I think back to those days when I was struggling all of those years in my early 20s, that I struggled with diet after diet after diet, and I felt like such a failure. And if I would have known to do this, I would have done it in a heartbeat. And so if my medical providers had had this option to offer me, it would have made a difference in my life. And you might be able to make a difference in someone's life by offering them this way of eating. So thank you very much for joining us. And I really appreciate your time.
Thank you. Grazie mille from all of us. Here's our contact information. Feel free to get in touch with us. We also would like to extend an invitation to our specialized conference, Ketogenic Solution for Lymphatic and Fat Disorders, which will be in Raleigh-Durham, North Carolina, November 2020. And what a pleasure to be with you today. Grazie mille.